good morning.
Good
My
morning.
name is Annie.
Nice to meet you.
Nice to meet you, Claire. I'm going to be taking care of your assessment today.
Okay.
Do you know anything about the nurse practitioner role?
I do actually go see a nurse practitioner. I
Oh,
know
good.
that they work in my doctor's office and they prescribe me meds and
Wonderful.
do my assessments.
Sure. I'm just going to wash my hands really quick and
Sure.
grab some gloves
Okay.
before we get started, okay?
Okay.
Okay, great. So do you have any concerns before we get started?
No, not today. Just general kind of visit, getting
Okay,
started
wonderful.
for today. Yeah.
So this assessment is going to entail a few different things. There's going to be some things that I'm going to just inspect overall with you. Like for instance, you're well groomed,
Thanks.
your posture is nice and erect, you're dressed appropriately for the weather. I'm not seeing like any sort of involuntary movements or anything like that. So
Awesome,
like your
great.
general appearance is great.
Good.
Other parts of the exam are going to be me touching you and like sort of palpating different areas and
Okay.
just checking for any abnormalities as
I
well.
appreciate that. Thank you.
Yeah, no problem. And then also we're going to get your vitals. So your vitals
Sure.
include your heart rate. We want to make sure that that's within normal range.
Mm-hmm.
Between 60 to 100. We'll make sure that your blood pressure is also within range for your
Mhm.
age and your size.
Mm-hmm.
We'll get your weight and your height, and then we'll look at the percentage of oxygen in your blood.
Perfect. Okay.
And how many breaths that you take a minute, and make
Okay.
sure that's sort of between like maybe like a 14 to 16 breaths a minute
Sure.
range.
Okay.
Okay.
Yeah.
So first I'm going to start with your hair.
Sure.
I'm going to look at how much you have.
Okay.
Is it evenly distributed? So,
It's all slicked back. Sorry
no,
about that.
no, you're fine. You're perfectly fine. So I'm not like really seeing any areas of hair loss.
Mhm.
The quality and distribution of it, the texture of it all
Mhm.
looks
Mhm.
as though it's in defined limits.
Mm-hmm.
I'll also look at your scalp while I'm here,
Okay.
and what I'm going to be looking for is just to see if there are any nits,
Mm-hmm.
which would be like the little eggs for lice. Just
Oh,
make sure you
okay.
don't have
Yeah.
those. We'll look at for any lesions, any scaliness, or like dry skin patches. Have you ever had any issues with that at all?
I just get like dandruff and stuff during, dry
Yeah.
winter times, especially right now, but
I don't even see, I see nothing. It looks like it is completely within limits.
perfect.
And the skull, your skull itself is like a really good size. I'm not really seeing any asymmetry here.
Mhm.
I'm looking at the front, the sides of your skull.
Okay.
This all looks great as well.
Okay.
I'm also looking at your facial expressions. Nothing looks asymmetrical. Everything looks as though it's within normal range. I'm not seeing like any spontaneity or like any spasticity with your muscles.
Okay.
Have you ever had any issues with TMJ whatsoever?
I kind of grind my teeth at night, so I get a little tenderness sometimes
Okay.
with biting down, but
I'm gonna palpate that area
Okay.
as well, okay? So I'm just gonna kind of touch here.
Mhm.
And I'm looking at your skin also while I'm doing this.
okay.
I'm not seeing any discoloration, any lesions. Your facial hair all looks within range. Any swelling or tenderness when I touch this area?
Just mildly tender.
Okay,
but,
go ahead and open your mouth. I wanna kind of feel the way that you're, oh yeah, I see that like kind of snapping and clicking.
Yeah.
Does that hurt?
A little. It's not
Okay.
too bad.
Okay, great. That's good. So next I'm gonna sort of look at your neck.
Mhm.
I'm looking for any scars, any sort of swelling, tenderness. It looks as though your trachea, which is your airway, is midline.
Mhm.
I'm not seeing anything abnormal in that sense.
Mhm.
Your
Okay.
neck looks perfectly symmetrical, and your trachea looks great. If you want to lift up your chin here, I'm going to
Yeah.
look at your thyroid. If you can go ahead and just give me a swallow. Your thyroid does appear to be a little bit enlarged. Do you have any thyroid history?
Yeah, I've got
You do.
Hashimoto's. My mom and sister and
Do
I
you?
have it. Yeah.
Okay. And then do your labs normally stay within range?
For now they do. I don't have to take any medication or anything. for
Oh,
that, so,
thankfully. Well, that's
Yeah.
a blessing
Yes.
for sure.
Yeah.
So next I'll probably check your range of motion as
Okay.
far as like your head and your neck.
Okay.
I would like for you to just lift your head up
Mhm.
and then go ahead and point your chin to your chest.
Okay.
Good. And then you can bring it back to center.
All right.
And then go ahead and tilt this ear down to this shoulder.
Okay.
Any tenderness?
Just sore muscles.
Okay. Good. Good. And then turn your, yes, exactly.
Okay.
It's like you're an exercise physiologist. It's like perfect. So now I'm going to come over and I'm going to palpate your thyroid from
Okay.
behind, if
Okay.
that's okay
Yeah,
with you.
absolutely.
Okay. So what I'm looking for is just to see like if I can feel this enlargement. I'm going to be kind of deviating it away because it sits like right over your trachea. Are you having any like swelling or discomfort when I do this?
No, it just kind of a little discomfort just from touching the neck.
Yes.
But otherwise, it's not.
I think
not tender.
Okay, that makes me happy. Go ahead and give me a swallow here. Okay, yeah. I feel as though you may have a nodule right here.
Yeah, I've been told I've got some nodules.
Do you?
Yeah.
Okay. No swelling, no discomfort. I'm going to also check your cervical muscles as well. No tenderness, no swelling here. And we're going to go down your back down here through your scapular area where it sort of meets your thoracic spine. No swelling, no tenderness here? Okay, great. Good. So next I'm going to just check your lymph nodes. And what we're looking for with your lymph nodes is that a normal finding would be that we can't really palpate any like asymmetry, so like different sizes. Most of them should be P-shaped, not hard, very movable. Your lymph nodes work sort of like your garbage picker-uppers of your body. So when you have any sort of like inflammation or any illness, it will come along and sort of collect all of those dead cells. Okay, so I'm going to start here with your pre-auricular, and then we'll go here to your post-auricular, submandibular, good. Submental, any tenderness?
Nope.
Great. And then we'll do your anterior cervical.
Okay.
Good. Posterior cervical, occipital, good. No tenderness?
No.
I'm not feeling anything that is of any concern. They all feel the same size. Everything is very movable. And then your supraclavicular here as well. Does that all feel okay?
Yes, yeah.
Okay, great. So now I'm just going to actually listen to your thyroid.
Okay.
Just because it is somewhat enlarged, and what I'm kind of listening for is what's called a bruit, and that's really just going to tell me how things are circulating with it.
Sure.
Okay?
Sure, absolutely.
And I'm not identifying any bruits there on that side. Good, good. Do you have any questions so far?
I don't. No.
Okay, super. Okay, Claire, so for this part of the exam, we're going to be looking at your ears, nose, and throat.
Okay.
And this is going to entail several different assessment techniques. Some of it's going to be me just visualizing different things about your ears, nose, and throat.
Okay.
And other parts are going to get a little bit more invasive, but I'll try to be brief, thorough, and as gentle as I can.
Okay.
So I'm going to go wash my hands and then grab some gloves and we can get started, okay?
Perfect. Sounds great.
Great. So did you have to work today?
Thankfully, no, I did not.
Oh, good.
Yeah.
Nice to have the day off.
Yeah.
Any big plans for the weekend?
Not at all, no. It's just
good.
me and my dog and my husband just laying around and enjoying the weekend.
Oh, I love that. So I'm going to go ahead and start with your ears.
Okay.
And I'll start by looking at them, and then I will also palpate them as well and kind of look inside of them.
Okay.
So with the ears, I'm just going to be looking for any sort of deformities, skin lesions, or any kind of masses that stand out to me.
Okay.
Your ears look very symmetrical, so I'm really not expecting to see anything like you weren't a wrestler.
No.
That sometimes changes the composition of the ears. They look great. I'm not seeing any nodules. You're not experiencing any tenderness or anything like that?
No, not at all.
Okay, I'm not seeing like any edema, no redness. None of that hurts, is that right?
Correct.
Okay, just gonna kind of feel over the mastoid.
Mhm.
That's all fine, no tenderness there?
Nope.
I'm gonna just press here on your tragus.
Mhm.
That feels okay?
Yeah, it feels fine.
So next I'm gonna just test cranial nerve number 8.
Okay.
Whoops, please excuse me one moment. So for cranial nerve number 8, what we're going to be doing, there's actually 2 different ways that we can perform this test, but the way that you and I are going to do it is I'm going to actually have you occlude one of your ears. I'm going to step about 1 to 2 feet away from you, and I'm going to whisper a word.
Okay.
And so I want to hear how well you're able to identify the word that I choose.
Okay.
And then once we do that one, then we'll swap ears. I'll come up with a new word,
Okay.
and then you'll repeat it back to me like you hear, okay?
Okay, perfect.
Okay.
Purple?
Very good.
Okay.
Excellent.
7.
Excellent.
All right.
Now, did you hear any differences in your ears?
No,
when we were
both sounded
listening?
clear.
Have you ever had any sort of hearing problems, or do you ever notice, like, when you get sick that it's more difficult for you to hear anything?
A little bit. I had tubes as a baby in my
Oh, you
ears,
did?
so yeah.
Oh,
so
okay.
sometimes it can be a little bit difficult, but
Okay.
otherwise both were fine.
So I'm sure you've seen this before all throughout your life, especially, you know, when you were a kid. This is an otoscope, and this is kind of what we use to assess the inside of your ear.
Okay.
So I'm going to be looking at the cone of light inside of your ear. I'm going to be looking for like a pearlish gray color.
Okay.
I'm going to look and see if there's any lesions, any redness, any erythema, or any perforation of the eardrum as well.
Okay.
As well as earwax.
Okay.
So I'm going to just come over here,
Mhm.
making sure my instructor can still see me.
Mhm.
Okay. Oops. I'm sorry, I must have turned it off.
That's
I
okay.
apologize.
That's all right.
I am visualizing just a little bit of wax.
Oh, I'm sure.
No redness.
Mhm.
The cone of light is visualized. Nice pearly gray color.
Mhm.
The middle ear appears to be intact. No bleeding, no exudate, no purulent drainage, anything like that.
Okay.
And no tenderness when I touch this, is that right?
Correct.
Okay. Now I'm just going to check the other one.
Mhm.
Sorry, I'm a lefty.
No, that's okay.
Okay, this one I do see some earwax as well, but
Mhm.
no redness, no tenderness, no bleeding, no perforation of the eardrum. I do see that nice pearly gray color that we
Okay.
like to see,
Okay.
as well as the cone of light.
Perfect.
And no pain when I'm doing this, is that right?
Correct.
Okay, great. That all looks good.
Okay.
Do you have any questions so far?
Mm-mm.
Good. And were you prone to ear infections at all when you were younger?
Yeah, I had them all
Were
the
you?
time. Yeah.
Okay,
Yeah.
good. Oops, I'm sorry about that.
No, that's okay.
And so there is another special test we use. We don't need to do it today because there were no abnormal findings in your
Sure.
physical assessment of your ears, but there's a test that we do that it's a mobility test of the tympanic membrane, and we use a pneumatic otoscope for that,
Okay.
where there's like a little puff of air that goes into your ear.
Okay.
But there's no need for us to actually do that today.
Okay.
There's another way that we can test for like sensoroneural hearing loss or any kind of like conductive hearing losses, like from exposure to too loud of noises or maybe possible like post-infection, that
Sure.
sort of thing. And those we would use the tuning fork.
Okay.
We could put that on the nose or on the head, and just the way in which the vibration moves throughout the head and the way in which you hear it and perceive it
Okay.
sort of tells us if there's a deficit on either side.
Okay.
But again, because you're not experiencing any sort of hearing loss,
Mhm.
we don't need to perform either one of those tests.
Okay. Okay. All right.
So we looked at, let's see, we looked at the outside of your ear, we looked at the inside of your ear.
Mhm.
You weren't having like any tenderness, right?
Mhm. Correct.
Now we'll go ahead and we're gonna move on to your nose.
Perfect.
Do you have any history with your nose? Like, have you had surgery? Have you ever broken it?
No.
Any tenderness? Are you prone to nosebleeds?
Mm-mm.
Do you get extra boogies? Have any problems breathing through your nose?
Sometimes.
Sometimes.
Yeah.
And no tenderness? I'm not seeing any
Nope.
redness. It's very symmetrical. I'm not seeing like any septal deviation, anything like that.
Mm-mm. That's good.
You have a really cute nose.
No, it's huge.
No, it's actually not. So then I'm gonna go ahead and I'm gonna look up into your nose
Mhm.
with this light. And so right now I'm just visualizing, making sure that you're not having any sort of tenderness. I can see your inside of your turbinates. Those all look great. I'm not seeing any exudate, no purulent drainage. Your septum is intact. No bleeding.
Okay.
I'm sorry, I know this is uncomfortable.
No, it's okay. Just tickles.
Everything looks great in this side as well. Your septum is intact. No redness, no tenderness, no bleeding. The turbinates look within defined limits as well. I'm not seeing any lesions, no masses. They're very patent. I want you to go ahead and cover one side of your nose and go ahead and take a deep breath in. Good. I know it sounds funny, right? And then go ahead and do the other side. Good. Does that feel pretty equal?
Yeah,
It
yeah,
sounds
just a
like
little
it.
congested, but
Okay.
yeah.
Now I'm gonna I'm sorry that I'm standing over you. Are you comfortable?
Put it down there.
Okay. You're good. I'm just kind of checking out your sinuses.
Okay.
No pressure here.
Nope.
Good. And then I'm gonna check the ridge here. Anything there?
No.
Good. So there is another test that we can do. It's transillumination of your sinuses. No need to do that today because you're not experiencing any abnormalities with your sinuses, like no illness, anything recent like that. But we're able to shine a light in different ways in order to visualize the sinuses better. And that's something that we would do if we were noticing some sort of issue.
Okay.
Some other things that we're gonna move on to is like your mouth.
Sure.
We're gonna look at your pharynx, your tonsils. Do you have your tonsils?
Yes.
Okay, so we'll be able to see those. We're gonna look for like, is there any exudate, meaning like, is there any sort of infection that's brewing?
Okay.
I'm gonna look for any ulcers, any white patches, redness, tenderness. Have you had a sore throat lately? Okay, good. That'll make it a lot easier. And then we're just gonna kind of like do a quick swipe of your teeth and look at your tongue and make sure that that's midline and not having any sort of deviation as well, okay?
Okay, perfect.
So I'm just gonna use the pen light. That's sometimes a little bit easier. We'll start here with the pharynx. And we're really just gonna look for symmetry. We're gonna look for color. I can't turn my pen light on anymore.
There you go. You got it.
Did I?
Yeah. Yep. Holding that down right there.
Oh, maybe it's broken.
There you
There
go.
we go. My goodness. All right, well, I'm gonna use the one that's here on my
Perfect.
name tag.
Great.
So just go ahead. It's not as bright as
That's
that
okay.
one is.
That's okay.
I'm gonna switch hands here because I am actually a lefty.
Okay.
So just smile for me really quick. I'm gonna check out your teeth. Gorgeous teeth. How many times have you
thanks.
have braces?
Oh, I've had them once, yeah.
Okay, I'm not visualizing any cavities. I don't see any abnormal positioning with your teeth.
Okay.
Nothing missing.
Okay.
Go ahead and stick your tongue out. Your tongue looks great. Lift up a little. Did you just have coffee before you came in? Okay. So it looks like your soft palate, your hard palate are nice and moist, intact. Your uvula is symmetrical. It's midline as well. Yeah, feel free to close whenever you need to. Go ahead and stick your tongue out. I'm just gonna look down here. Okay, your tonsils, I would rate them as 0, honestly. Maybe like a plus 0.5. But all of that appears to be intact, moist, without redness, swelling, tenderness, lesions, no patchy spots on your tongue at all.
Okay.
There is another test that we like to do on the tongue just to check for any sort of residual on there, okay? So go ahead and stick it out again. Okay. Good. And then go ahead and lift your tongue, move it around for me. Yep. Okay, so no issues. Your tongue is midline. You're not feeling like any tenderness, no kink or sores or anything like that. Okay, wonderful. And then now I'm just gonna kind of take my hand and I'm gonna go ahead and smile. Yep, I'm just gonna rub. Okay, your teeth all feel great. Your gums are nice and pink, moist and intact. No evidence of any sort of infection or issues or any sort of problem there.
Okay.
Okay?
Okay. Okay.
So next we're gonna be moving on to another exam and I'll be right back for that.
Okay.
Okay, Miss Claire, so now we're gonna do your hair, skin, and nails assessment.
Okay.
And just like the other ones that we did, we're gonna go through visualizing these things, lots of palpation, touching, assessing,
Okay.
you know, both visually and hands-on as well.
Okay.
So I'm just gonna grab some gloves. Now, do you have any sort of history with your hair, your skin, or your nails at all?
Nope.
Okay, great. So now I'm really just going to be looking for pallor, or like, is your skin pale? Are you jaundiced? Are there any signs of cyanosis? I'm gonna be looking at several different parts of your body.
Okay.
I notice you do have artificial nails,
Yeah,
but I
sorry
am
about
still able to see your capillary refill, which is wonderful.
Okay.
I'm also gonna take a look. Let me see this one as well. This looks good.
They're healthy.
Looks very healthy.
Okay.
Let me take a look at your feet. No signs of cyanosis, no pallor, no erythema, no jaundice. I'm gonna take a look in your oral cavity.
Okay.
We're gonna be looking for the same thing. You know, we're checking out to see, do you have any lesions? How is the color? It's moist, it's intact, no pallor, no cyanosis. I'm not seeing any signs of jaundice as well. Do you have any sort of significant history, like with your skin or your hair? Can I see the palms of your hands as well? Okay, these look good. No lesions, no abnormalities. Let me see the bottom of your feet. So cute, you know.
I'm ticklish, sorry.
Are you? I'm sorry.
No,
You know,
that's
I'm
okay.
No swelling, no tenderness. Oh, I do note a scar here. What's that from?
I had surgery on my foot, probably probably closer to 10 years ago.
Oh, wow.
Yeah.
So I'm just going to look here at your upper and lower extremities. We're looking for signs of hyper or hypopigmentation. Do you have an animal in the home? I see you have a little bitty scratch here.
Yes, yeah, I have a dog. She
She
doesn't
must be
realize her
active.
size.
Is
Yes.
that what that is?
Yep.
Okay. Okay, that looks good.
Okay.
And then I'm just gonna take a look at your legs. No hypopigmentation, no jaundice.
Okay.
Okay. Now I'm gonna look at your scalp. We're gonna look at like the distribution of your hair.
Okay.
And make sure that you don't have like any lesions. We'll see how much hair you have. Do you mind taking it down for me?
Oh yeah, not at all. I can try at least.
You have a ton of hair.
I
It's
do.
really pretty.
I do. Thank you. It's probably in a knotted mess, so.
So we're gonna look at your scalp and your hair. Do you mind if I just part
No,
it? Go
not
ahead
at
and
all.
drop
Okay.
your head for me.
Mhm.
Thank you.
I like a little slick in it, so.
No, I like it. Now, have you had any history of dandruff? I do notice just a little bit of buildup here. But they flake off really easy, which means that there's no concern for any kind of like, nits or anything like that. No irregular shape or anything. Looks like your quantity is equal. It's well distributed throughout.
Okay.
That all looks okay. Okay, I'm sorry about that.
No, that's
There
all
you
right.
go. Sorry. Now, do you have any birthmarks or any lesions on your extremities?
No, I do have a mole on my arm. I've
that's
had it
right.
for years.
I was distracted by the puppy move.
I know.
Yeah. So the way that you have had this for years.
Oh yeah.
Okay.
For as long as I can remember.
So we're gonna assess these with a mnemonic
Okay.
that we use called ABCDE.
Okay.
And so what we're looking at is asymmetry. So this one is very symmetrical, which is a normal finding.
Okay.
We're also looking at the borders. The borders are very regular here. The color looks evenly distributed as well. The diameter, I would call this maybe like a 1/2 centimeter, would you say? And how has it evolved over the years? Has it changed at all?
It did over one point get like a little bit bigger, but I went immediately to my dermatologist and they tested it was fine. So
And they said that was all good?
yeah, they
Okay,
measured
super.
it and all that and it's been fine.
That's
Yeah.
great.
Yeah.
So now I'm really just gonna kind of feel around the distribution of your body for temperature.
Okay.
And everything feels pretty normal. Your tootsies are a little bit cold.
I get chilly feet.
Yeah,
Yeah.
but it's winter.
Yes.
I mean, as far as like your hands and everything
Yeah.
like that, that all feels okay.
Mhm.
And then we're gonna also check just your skin turgor to see like your hydration status, and it all really kind of goes back pretty quickly. There's like no delay there, which is wonderful. And then I'm gonna have you kind of turn around for me so that I can see your back.
Yep.
And I'm not seeing any like excessive dryness.
Okay.
You do have a little bit of breakout here.
Yeah, I
And
get,
this is
get
like from
some
working
back
out?
yeah.
And you can actually use, I don't know if you've ever used like Head and Shoulders or anything, but you can use that on your back as well.
Oh, really? Okay.
Yeah, I just read a paper about it recently.
Oh, wow.
And is this area like tender or swollen at all?
No, I get itchy a lot anyways. I just very dry skin, so I
I'm just
scratch a lot.
palpating the texture of your hair
Yeah.
really quick,
Absolutely.
just to make sure that it feels very healthy.
Oh, thank you.
Yeah. Sometimes when the hair is unhealthy, it gets very springy like a rubber band.
Sure.
You know, but this feels very healthy.
Mm-hmm.
I'm just going to take a look at your fingers and your toenails,
Okay.
and then this should conclude that exam.
Okay.
We did look at your fingers and toenails
Mhm.
before.
Yeah.
That they look very healthy. I don't see any splits. I don't see any yellowing.
Okay.
No signs of cyanosis. No
Okay.
clubbing of your nails or
Okay.
anything like that. Gosh, you sure do have really cute toes. And really the only thing that I'm noticing is that they're cold, but you have really good capillary refill, so
Mhm.
that's all within normal limits or within defined limits.
Okay.
Do you have any questions about today's exam?
I just had noticed you had mentioned jaundicing. Can you like speak more to that? Like, what does that mean?
Yeah, so jaundice is like a yellowing of the skin that we can identify whenever the liver is having a hard time functioning at a normal level.
Yeah.
And so that starts to, the bilirubin starts to build up in our system,
Yeah.
and you start to see like that yellowing. So
Okay.
that's something that we can see in lots of different places. We can see
Okay.
it in like the sclera of your eyes, we can
Okay.
see it like on your lips,
Mhm.
which we didn't identify any of that. Your eyes, the sclera of your eyes appear very normal.
Okay.
Smile for me.
Yeah.
When I look at your gums, all of that, none of that is identifying any
Okay.
sort of signs of jaundice as well.
Okay.
So definitely not a concern for us.
Good. Thank you.
But thank
Just want
you.
to make sure.
Yeah.
Thank you so much.
Yeah, thank you so much. Okay, Claire, now we're going to continue on with your eye examination.
Okay.
We'll start here with the Snellen chart. I'm going to have you cover one eye.
Okay.
And I'm going to stand about 2 feet away from you while you read the small list of letters.
Okay. DEFPOTEC.
Excellent. Go ahead and uncover and then cover your other eye.
DEFPOTEC.
Excellent. Now go ahead and uncover both eyes and read the smallest series of letters that you are able to.
So same DEFPOTEC.
Excellent. So you are able to see 20/20.
Great.
Excellent. Now we're going to check your visual fields.
Okay.
I'm going to be wiggling my fingers in your peripherals, and I want for you to note when you're able to see my fingers wiggling.
Yeah.
We'll do that on both sides in 3 different areas.
Okay.
We'll start here with your left eye.
Mhm.
Just let me know when
No.
you can see. Okay.
No.
Excellent.
No.
Excellent.
No. Good. No. No.
Good. Now I'm just visualizing your eyes and your sclera.
Mhm.
Your eyelashes are very long and pretty.
Thank you.
And they're all facing the same direction with no abnormal growth.
Mhm.
I'm not visualizing any swelling or discharge. The vascularity is intact. No redness. I'm going to go ahead and pull up. Go ahead and look down.
Mhm.
Thank you. And then go ahead and look up. Excellent. Go ahead and look both eyes to the right without moving your, excellent. And then the other way as well. Okay, so I'm not seeing anything abnormal, no nodules. The color of your sclera is white and intact. I'm not seeing any jaundice or any discharge. And I feel as though that is all intact.
Okay.
So now we'll go ahead and look at your lenses and your corneas.
Okay.
I'm going to be shining my pen light just here laterally in the sides of your eyes.
Mhm.
And I'm not identifying any obliqueness. Excellent. So now we're going to assess the depth of the anterior side of your eyes. I'm going to be pointing directly towards your irises. Excellent. The depth is within defined limits. They are both symmetrical. Now I'm going to be looking at the shape and size of your pupils. Your pupils are approximately a size 4 on the right and also a 4 on the left. They are both equal and round, and now we're going to see how they react to light.
Okay.
So you can just continue to look at me.
Sure.
And I'm just gonna watch how they react with light. That's
Sure.
excellent. Nice brisk movement.
Mhm.
Both of them equal, round, reactive to light,
Mhm.
and also accommodating.
Okay.
I'm going to have you cover one eye,
Mhm.
and I'm gonna have you look into the distance while I shine the light into your pupil.
Mhm.
Good. Go ahead and look past me. Excellent.
Okay.
Excellent. Now I'm going to hold a pencil about this far away from you, well, a pen light actually. And I'm gonna keep that about 10 inches from your eyes.
Mhm.
And then I'm gonna have you look at the pencil.
Okay.
And then I want you to look into the distance
Mhm.
and then back at the pencil. Excellent.
Yeah.
That's excellent. So now I'd like to check your corneal light reflections.
Okay.
I'm going to actually shine a light in your eye. If I can get it to turn on there, I apologize.
That's all right.
Good.
Mhm.
Am I far enough away, maybe? And the reflections in the light reflections in your eyes are intact.
Mhm.
Now we're going to check your extraocular movements.
Mhm.
We'll be checking convergent, looking for like any kind of gaze or nystagmus, okay?
Okay.
So now I'm going to take my finger, and I would like for you to follow my finger only with your eyes. So try
Okay.
to keep your head straight, okay?
Mhm.
Here we go. Excellent. Really good. So that test was also within our defined limits. I'm not seeing any abnormal extraocular movements, no gaze, no nystagmus, no lid lag, anything that would be any sort of concern for me.
Mhm.
Some of the special tests we could do is we could do a color blindness test if you were having trouble identifying like stoplights or something like that. That
Sure.
would be a special test we could do.
Okay.
There's also another cover-uncover test where we can test for like eye deviations.
Mhm.
And then we have an aversion and inspection of the lids that we could do, but those are tests that are not necessary at this time.
Okay. Good.
So now I'm just gonna dim the lights so that I can take a closer look with my ophthalmoscope.
Mhm.
And we're gonna be looking at lots of different things. We'll be looking at your lots of things. Let me think for a second of all the things that we're gonna do. We're gonna look at like your optic disc, your retina, fovea, macula, and we'll be checking red reflex as well. So
Okay.
I'm gonna go ahead and dim those lights, okay?
Okay. Yeah.
Is that about okay?
Mhm.
Okay.
Yeah, that's okay.
Just go ahead and look straight.
Mhm.
Excellent. Good. Excellent. So now I'm gonna hold it at a 15-degree angle, about 15 inches or so away. And this test is so that I can see the red reflex. Good. Excellent. So now I'm gonna just move a little bit closer one more time so that I can inspect the optic disc.
Mhm.
Good. Clarity looks good. Your outline, the shape of your physiological cup. You have symmetry between your eyes, no papillary edema whatsoever. Your retina is intact. I'm able to visualize your arteries. They are smaller than your veins. They appear lighter in color, more of like a lighter red, whereas your veins appear to be darker.
Okay.
I'm not seeing any lesions, no masses, no hemorrhages, no exudate, no areas of concern. Your fovea and your macula are also free of hemorrhaging, cysts, and exudates.
Okay.
Do you have any questions?
I don't.
Okay, that concludes this part of the exam.
Thank you.
Thank you. Okay, Claire, we're going to just move into the last section of our exam.
Okay.
So throughout the various areas, I have been assessing
your posture, which is erect, your mood, and your behavior. Your behavior is appropriate to the situation.
Okay.
Your mood is very pleasant. You have no like flat affect, no signs of like paranoia or overt suspicion.
Okay.
I think that you are well dressed, well groomed. Your personal hygiene is well kept.
Mm-hmm.
You do not appear disheveled.
Okay.
Your facial expressions are also within defined limits. I'm not seeing like any tics. I'm not watching you see things that maybe aren't there or having your attention. Otherwise, you're not having a difficult time, maintaining eye contact or anything like that. Next, we'll move into like your speech and language. So the rate and the fluency of your conversation is very fluid. You're very articulate with your words, and I have not picked up or identified any signs of aphasia with you.
Okay.
I don't identify any indifference with you or any sadness.
Mm-hmm.
I think that you appear to be a joyous person. I don't identify any signs of anger.
Mm-hmm.
I know anxiety can sometimes disguise itself a little bit more.
Mm-hmm.
Are you prone to any sort of anxiety?
I don't like being out in like crowds and things like that, but
Sure.
Otherwise, no, not
That's
too much, no.
understandable.
Yeah.
And then do you take any medication for that anxiety?
I don't. No.
Or would you like to seek any help for that?
No.
Okay, okay, great. I just wanted to make sure. So
Yeah,
now
thank
we'll
you.
move into the next portion of the exam, which is kind of our thoughts and our perceptions. So
Sure.
I really just wanted to kind of gauge, like your logic and your coherence. No, you're fine. So I really want to identify the content of your thoughts maybe, and do you have any obsessions? Like, is there anything that you're obsessed with or you can't stop thinking about?
Mm-mm. No.
Do you have any phobias?
I don't like snakes or clowns, but
I think that's pretty fair.
Yeah.
And then your thought processes. So do you have any delusions? Have you ever experienced any delusions?
Mm-mm.
And then have you ever felt anything like crawling on your skin? Do you hear anyone talking to you that might not be in the room?
Mm-mm.
And then have you ever seen something that maybe somebody else hasn't seen,
No.
like in a room?
Mm-mm.
Okay, great. So also your insight and your judgment appear to be in line with reality.
Mm-hmm.
Throughout this exam, your responses have been appropriate.
Mm-hmm.
Now we're going to move into like the cognitive function of this exam. So we're going to
Okay.
just it's going to seem a little bit gamey.
Mm-hmm.
First, I'll ask for you to tell me, do you know the year?
Mm-hmm. 2024. Sorry.
Okay, and tell me your name.
Clark.
Okay, and I know we did this earlier, but then also tell me where we are.
St. Anthony's Medical Center.
Okay, and then I'm going to have you add a series of numbers together. Okay, so what is 7 plus 3?
10.
And then what is 10 plus 8?
18.
Good. And what is 18 plus 4?
22.
Good job. You did great. Don't worry. It's kind of hard when you're on the spot
Right,
like
right.
this and you're trying to like remember different things.
Sure. Yeah.
Okay, can you spell the word world backwards for me?
Yeah. DLROW.
Excellent.
right.
Yeah, I think that was perfect.
Yeah.
That was great. So are you able to like recall where you went to elementary school?
Yeah, I went to St. Rita's in Rockford.
Oh, excellent. Okay, super. And then can you describe to me what the weather was like today?
Yeah, it was a little chilly, but the sky was clear today. So
Okay,
it's not
great.
too bad.
So I'm going to give you 3 words to remember, and in a couple of minutes, I'm going to ask for you to recall what
Okay.
those words were. Okay.
Okay.
So the words that I'll choose are male,
Male.
mm-hmm, remote,
Okay.
and wall.
Male, remote, wall.
You got it.
Okay.
Yeah. Also, I want to check your higher cognitive function as well.
Mhm.
So I'm looking to see if you know information such as who's the president.
President right now is Biden.
Excellent. And then what is your favorite movie?
I like a lot of movies. I like Bridesmaids.
Oh, that's a good one. Yeah. So now I'll ask for you to add a couple of numbers together and then multiply after that.
Okay.
So what is 20 plus 20?
40.
Good. And what's 40 plus 20?
60.
Good. And then what is 6 times 6?
36.
Excellent. And then what's 5 times 5?
25.
Excellent. So now we're going to talk about a little bit of abstract thinking. When you think of the proverb, let me think of a proverb that I could ask you about. What does the early bird catches the worm mean?
Those usually that are on top of their work are able to get up in the morning, usually get their work done and get to their goal quicker.
Yeah, that's perfect. So now I'm going to give you a couple of words I want for you to be able to identify what they have in common. Okay. So I'm thinking of horses, cows, and pigs.
Well, they all live on a farm.
Yeah, that's exactly right. That's exactly what I was thinking. So now we're just going to go through a couple of different drawings. This is what we call the constructional ability of this exam.
Okay.
Before I get you drawing, I'm going to ask you a series of numbers, and I'm going to ask for you to recall them, okay?
Okay, I'll do my best.
You're going to do great. 9351.
9351.
Excellent. 25962.
25962.
Excellent. 762593.
762593.
Yep. 3271654.
3271654.
Yes,
Okay.
Very good, very good.
Okay.
Okay, so now I'm going to ask for you to take the pen.
Okay.
And I would like for you to please draw a circle.
Okay.
Good job. And then can you also draw a triangle?
Yeah.
Great. And then can you draw a clock to the best of your ability? Great.
Oh, jeez. Almost went backwards.
It's okay, it doesn't matter.
Like that?
Good. And then do you remember the 3 words that we came up with before?
Oh, yeah. Mail, remote, and wall.
Excellent.
Okay.
Good job. Okay, that includes our exam, Claire. Thank you
Okay.
so much for
Thank
letting
you.
me take care of you.
Thank you.
Yes.